Hi guys, hello, new second years as you will be. How are you doing? How are you doing? We are going to go through Unit 14 now. Okay, so this is your summer holiday work to do. You have to do this before the 1st of September. Guys, if you don't do it, you are going to really struggle with the workload. So please, really, really think about that. It's only going to be a few hours work, I promise, over the summer. I know it's unorthodox, but in this current climate, like you've got to be doing a little bit of work, and it's not like you're going to be swanning off on your holidays, unfortunately. So, first and foremost, all the information is in the second book. Okay, so this is the second book. You've been working for the first book all year. It's on LRC and you can get it online. That's absolutely fine, easy peasy. The page you're going to start at is 188, so 188, and that tells you like all the grading descriptors, like what the criteria is, like basically for your assignment briefs. But I've already given you your assignment brief, so this is going to be basically doing the workload, which is going to be your P1 and P2, which is pretty big. So the more you can do, the better you can make it. Look at the assignment brief, see what it asks you. You're literally doing more than half of your assignment. Okay, so let's try and crack on with that. Let's see where we're going to go. This is a lot of work, okay? This Unit 14 is one that I really, really love. And I'm really hoping you're going to enjoy it as well. The way that I'm going to help you enjoy it is you are going to choose what you research. So this module is about physiological disorders. Sorry. Okay, so last year we did Unit 5, which is anatomy and physiology. So that was when stuff worked well, okay, when things are going well. If you did the distinction criteria for assignment 3, you did start looking at when things start to go wrong. This is taking that even further. For this assignment, you've got to choose 2 physiological disorders or diseases to research. You choose which 2 that you do. That's key. You decide which 2 to choose. One of those 2, you have to know somebody who's either had it or is still living with that disorder. And it might be a friend of a friend, it might be an auntie or an uncle, because for the distinction criteria for this assignment, you need to give them a questionnaire. So make sure that you choose one of these disorders that you choose to research. You have to know somebody who has suffered with it in the past or is still suffering. And I'll give you lots of options in a bit. I'll give you lots of things to choose. Okay. How this module is going to work. It's mostly going to be online. Okay, mostly we're going to be working on Microsoft Teams, which is going to be like the new Zoom. I've asked you to download that already, phone and laptop, because it might be that you're going to have the meeting on your phone and then be working on your laptop at the same time. That's going to be up to you, however you're going to work it. Differences from last year, you've got to be doing more of your own work, more of your own research, okay, which might be a little bit more tricky for some of you, but that's why I'm giving you the first bit over the summer to do. Plus, look at page 188, look at what this assignment's going to ask you to do, so you can start even going and doing some further research if you want to, if you're sensible. If you think, I do struggle with time, let me try and get some research done. What do I expect from you? Really, what you did for me this year. Like you've always been a really good couple of groups. I've enjoyed teaching you. So just keep on going. Really, you know that I'll help you. If you do drafts, I'll always help you. You know that. Like that's not a secret. So just keep on asking me questions. What do you expect from me? Just help, and I hope I can still do that with you. That's fine. Your hand-ins. Now we're going to be stricter on hand-ins this year. If you are late and do not have an extenuating circumstance, you're going to be capped at a pass. And I'm deadly serious about that. So if you don't hand it in, but there's not like a really good reason why, I don't care how much work you've done, I'm capping you at a pass. Like you've got to start being a step up a little bit. Most of you are going to be going to university, and some of you are going to be going to jobs. You can't just swan in late or hand in stuff late. It doesn't work that way. At university, especially, a late hand in capped at a pass. So we're going to start getting that down this year. Turn it in is the same, and obviously referencing. If you hand in on time, but it's not referenced, I'm also going to cap it at a pass. I've been banging on at you so much this year. So, you know, really it's down to you this time, okay? So how this module is going to work, so everything's going to be on Moodle. Or, you know, I haven't got Moodle set up yet because we haven't been given access to it. Hopefully in August when we come back, I can put everything straight away on there. But I've emailed you loads of this stuff anyway. Assignment briefs, folders. I'm going to give you the summary, hand in, and I'm going to give you those times. You've got resubmissions, all going to be on Moodle. You know, why are we doing this assignment? This assignment is going to be super important for 99% of you moving forward. Even if you think, oh, well, I'm doing criminology, how is that relevant? It's all about researching. You know, you're going to be looking at the criminal mind, depression, schizophrenia. It's all going to be doing that kind of looking and seeing and researching that area. And even if you're going straight into a job, you still need to be able to research. So this is going to be like one of those really important units. Now, guys, when you're thinking of two disorders you choose, think about what it is you're applying for at university. So I know, you know, we've been doing personal statements already, but as we edit them, what you need to be thinking at is which disorders will be great to research so I can show off in my interviews for university. So let's say you're doing like adult nursing, looking at cancer will be fantastic, yeah? If you're looking at pediatric nursing, what can you look at in terms of pediatric disorders? If you're looking at psychology, what can you be looking at as a biological, psychological disorder? So, you know, I want you to go and start thinking about what would be good for you to do. Okay, ignore that one. References, for God's sake. Okay, changing words around from something you've read does not make it your own words. Okay, copying pasting a paragraph, then changing it all around, that's still cheating. It's still plagiarism. I want to read what you think. Okay, the LRC will still help you. You can still email them, send them your work, use them for goodness sake. Okay, just it's just going to be remotely instead of face to face. And again, a couple of useful links for you to look at if you are still thinking about referencing. I'm not still 100% sure. You go here. Okay, assignment 1, we're going to be looking at the disorders. We'll be looking at signs and symptoms. How do we diagnose these signs and symptoms? How do we diagnose these disorders? And also, how do we assess the possible difficulties involved in diagnosing? So, you know, it's not just always a case of here's a test, here's the result, that's what's going on. There's lots of difficulties that can happen, so we're going to be looking at those as well. We're not going to worry about assignment 2, it's a big one, but it is about these care pathways. So once from assignment 1, you're looking at how do we diagnose an issue. Assignment 2 is basically how do we treat the issue. And remember, at any point, you can pause. Okay, you can pause this presentation, have a read and make some notes if you want to. Okay, oh my God, yeah, it's massive. This is going to be one of the only ones that's a long narrated PowerPoint where I'm going to be talking in the bottom of your screen. But basically, guys, just press pause and come back to it if you need. Okay, that's absolutely fine. You do this in your own time. This is all in your own time. All right, today's aim. So what we're going to be looking at today, what is physiology? What is a physiological disorder? We're going to look at examples, okay, and those examples you can choose from if you want to. As health and social care practitioners, what do we need to know? How are they diagnosed? Obviously by their signs and symptoms, and we can look at, you know, what is a sign, what is a symptom. Okay, so first of all, guys, what is physiology? You've done Unit 5, okay, so what is physiology? It's the study of normal function. So far you've looked at normal function. When you get hot, what normally happens? When we eat, what normally happens to our blood sugar? So that's our normal processes. It's a subsection of biology. We can look at it as a whole, or we can even look at individual body parts. So you can look at human physiology, brain physiology, sports physiology, big toe physiology, you know, looking at a big toe. what should normally happen in a big toe. Okay, what we're going to be looking at is then what happens when it doesn't work. Okay, you know this word, homeostasis. If all of our body systems are working well, physiology is working well, and that's obviously what we're going to be looking at. Okay, alrighty. What happens when it goes wrong? So we've got our 11 body systems. Task. What are the 11 body systems? In Unit 5, I gave you a sheet with all the 11 body systems on it. Find it. Okay, I need you to have that with you during this assignment. Okay, so you can pause now, or you can make a little note to do it later, but you need to find that sheet. It's on Moodle, it's under Unit 5, okay? Body systems, one sheet, or you can Google it. Just make sure you get the right ones, but go in the textbook if you need. Remember, that list is in the textbook, but that'll be in textbook 1. Unit 14 information's in textbook 2. So what happens when it goes wrong? Okay, so when something goes wrong, it's not always the worst thing in the world. We don't always need doctors and nurses and A&E. It's a cough or a bad headache, we can fix it. Lemsip, paracetamol, a hairbrush, maybe a grade 1 shave your head if it's that bad. But, if it isn't something we can fix really quickly with, 1 paracetamol, then we have a physiological disorder. We need more help. And that's what today is going to be about. That's what this unit is all about. Okay, so these are the disorders that you guys can choose from. Now, I don't expect you to know what these all are, and that is absolutely fine. Okay, diabetes, type 1 or 2. Don't do both. You just pick one. So this might be, do I know somebody with type 2 diabetes? Could this be something I could research? That's what you're going to look at. Coronary heart disease, anything to do with the heart. Stroke, do I know anyone who's had a stroke? Hypertension, which is high blood pressure. Parkinson's, so Alzheimer's, dementia, stuff like that. Do I know anybody who's had that? May I, is that what I'm going to research? So I can do some of my distinction criteria on that potentially. Motor neuron disease, multiple sclerosis, MS, rheumatoid arthritis. You can do osteoarthritis as well, but it's a bit more difficult to research. Osteoporosis, Crohn's disease, inflammatory bowel disease. That could be colitis, diverticulitis, those types of things. Cancer, but you pick one. Breast cancer, liver cancer. Okay, so you're not to do cancer generally. You're going to pick one specific area of physiology to look at. Leukemia and deficiency, so iron deficiency diseases, stuff like that. You can choose one that's not on this list, by the way. That's absolutely fine. If you have someone in your family or friendship group who's got a disease that's not on here, you can research that. That's absolutely not a problem. Maybe just check in with me to make sure it's a good enough one. More because I want to make sure that there's enough to research. But, just check in if you want, that's fine. Okay. What you're looking at here, what do we need to know? This list is basically your P1 and P2. Okay, so this is what you're going to research. This is effectively your homework, your summer work. You're going to pick 2 disorders. Take your time choosing them. Yeah, take your time. Don't do the same ones as your best mate. It's going to be really difficult to keep them separate. Okay, so try to make sure you're not doing something. If you know that you work with somebody in the group, make sure you don't do the same as them, because it's easy to kind of plagiarize accidentally, and just choose something separate. We will look at the causes, the changes to the body systems, the changes to the overall function. So how does the body function with this disorder? We look at the changes due to treatment. So what's the treatment? And then what are we looking to actually affect? And influences. So it could be, is it inherited? Is it genetic? Lifestyle choices? Is it to do with employment, people's diet, environments, that kind of stuff? All right, that just says etc. Out the C, sorry. So yeah, there's a few things there to look at. Now, you can actually use these as subheadings. So if you wanted to, again, pause, open up a Word document, write these up as your subheadings for your 2 disorders, and this is your assignment. Like, this is literally your assignment. So, you know, if you want to, that's fine. So in terms of the causes, you need to be researching. So if I'm doing type 2 diabetes, I'm going to research what are the causes of type 2 diabetes, and they can be obesity, it can be diet, it can be cultural groups. Why do we get it? You know, what is it, and you know, why do we get it? So that's going to be your research for your 2 disorders. Then you're going to look at the changes to the body systems. So if you haven't already, you've got to get your picture of your 11 body systems. And what you're going to do is you're going to research each one and see, does it affect it? So for example, if you're looking at, let's say, coronary heart disease, so anything to do with the heart, one of your subheadings will be cardiovascular system. It affects da, 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 da. But heart disease might not affect your urinary system, your renal system. So if it doesn't affect a system, just don't talk about it. But you need to look at all of them to make sure that you know it doesn't. And again, it's all about research, and you can take your time and do it. Remember, as you go through each section of your research, just come back to the slide and listen to what I'm saying again. That's easy to do. Separately, excuse me, you need to look at the functions. So bodily function. So if I'm looking at colitis, which is an inflammatory bowel issue, the slide before, you would talk about the digestive system. How does it affect the system? This area, you're talking about the function. So you might talk about how it affects eating. How does it affect sleeping? How does it affect walking or working? And again, you can use those subheadings for any of the ones that you choose. Cancer. How does it affect eating, sleeping, working? You know, you can work. So think about the functions of your body: eat, sleep, rave, repeat. No, sorry, terrible joke. And then see how it affects it. Okay, and again, you're going to list them and talk about them. Now, this is the area that people fail on. Okay, so when you hand in assignments, this is the area that people don't get right, because they do only the first bullet point. Okay, so the first bullet point is treatment. What is the treatment? And they list the treatment. So they'll list the medication, they'll list the treatment. So they'll just put cancer, chemotherapy. Yeah. Inflammatory bowel disease, steroid medication. That's not enough. Okay, you need to include the second bullet point as well. So what are the treatments actually trying to affect? So when you're looking at, let's say, inflammatory bowel disease, you might talk about the steroid medications, and then you say, because the steroid medication is trying to do in cancer, one of the treatments is radiotherapy, and radiotherapy aims to do okay, so you've got to put that extra bit of research and time in there. And again, you've got the whole summer. So if you're looking at this in the end of August, come on guys, like, help me out a little bit, okay? And then we also need to know about the influences, okay? So everyone has got to tell me, is this genetic or not? So inherited traits there. Is it genetic, yes or no? That's the first thing you're going to be writing about. Is it to do with people's lifestyle choices? Is it to do with their employment? You know, is it something to do with the chest, lung cancer, emphysema, and they've worked all their life up in roofs? Is it something to do with asbestos, which is really bad for your lungs? Lifestyle choices are things like smoking, drinking, diet. So, you know, if you're looking at anything to do with the digestive system or cancers, is it anything to do with the diet? Could it be to do with red meat or not eating meat? and environmental stuff as well. So where do you live? What kind of place do you live in? Those kind of issues. So have a look at those as well. Then we move on to our diagnosis, which is P2. So the slide before is P1 and this is P2. So signs and symptoms. So these might be where you start making some notes, maybe pause. A sign and a symptom are two different things. A sign is something you can see. A symptom is something that you feel. Okay, so the sign is something that you see from the disorder, and a symptom is something that you feel because of the disorder. So let's say we're looking at osteoporosis, which is where people's bones get weaker. You see people getting shorter and getting more slumped. So that's a sign of osteoporosis. Okay? Think about your grannies and your granddads. See how they're getting shorter and shorter? Yeah, bones get weaker as we get older, and that's like an osteoporosis sign. Symptom is what they feel. So they might feel back pain, achy joints, they can't sleep, that kind of stuff. So sign and symptom. So look at your two disorders. What are the signs? What are the symptoms? Okay, some of the diseases might have loads of symptoms, but you can't see a lot. Some of them might have loads of things you can see, but they don't really feel anything different. So it doesn't matter, but as long as you kind of research them fully, that's absolutely fine. So, for example, on a stroke, okay, so a sign. Now, you had a brief look at the FAST poster campaign for stroke. Face, arms, speech, and time to get on the phone to 999 for if you have a stroke. So a sign of someone with stroke, you can see their face droop. Okay, that you can see their speech is slurred, they sound like they're drunk, they might fall over, they might go unconscious. Okay, that's a sign you can see. A symptom, they might feel headache, pain behind the eyes, they might feel sick, they might feel weak, they might feel like they're going to pass out. Okay, so those are signs and symptoms. And cancer, signs, what do you see with cancer? Different, isn't it? It's lots of different types of cancer. So that's why you need to pick one if that's what you choose. So you might see weight loss, rapid weight loss in somebody with cancer. You might see a lump, swelling, a tumour, maybe. What do you feel? People with cancer feel ill, they feel sick, they feel tired, they feel in pain. Okay, so you've got to look at those two separately. But again, as I said, the biggest thing which people get wrong is don't link it to the physiological changes. Okay, so if you say somebody with cancer, you see rapid weight loss, that's not enough. You have to link it. So I've got a little frog in my throat. You link it to cancer. So someone's got cancer, the sign is they lose lots of weight. Why? Why do they lose loads of weight? And that's what you've got to research, and that's going to get you that pass first time. All right, got to link it to the actual disease. Okay, when it comes to diagnosis, and this is for P3 now, this is for P3, you need to research who is involved in diagnosis. Who is involved? So a lot of people, it will be the GP. So you feel unwell, you go to the GP. Yeah. Some people, it will be hospital. So let's say if you're having a stroke, so yours will be paramedic and then an A&E. Okay, different pathways, but you've got to research, list them at this stage, list them all. And specialists. Don't say cancer specialist. Who are they? What is that name? Get some research. And who else? So every single people involved in the diagnosing of your disorder. So let's say they do a blood test. Who takes the blood test? The nurse. Where does that then go? It goes to a laboratory. Okay. Who looks at blood results? That is a phlebotomist. Okay, that begins with PH, phlebotomist. So a phlebotomist is involved in blood tests. So looking at all of those tests. Now, again, in the textbook, there is lots of information about tests. So let me find you those pages. And bear in mind, all this stuff I've talked about is in here. All the signs and symptoms, diet, environmental, everything is in this textbook. So for God's sake, go and look at it. It makes it nice and easy for you, okay? So from page 199, all right? So from page 199, who's involved and what tests do they do? So they're going to look at those tests. You're going to list them. So for P3, at this stage, just list them all. Research them all, list them all. And what do you do when you've researched it? Save the link. That's going to be for your referencing. Okay, so these are useful links. All right, so the first link there is your unit content. I've emailed you that separately. So again, you can go through and see what it is they want to do. The bottom 2 bullet points are lists of disorders that you might choose to do. But again, in the textbook, on page 192, there is again a nice list of different disorders you might choose from. It also talks about different body systems that are involved. I just want you to have a look at this. There is so much in this textbook that's going to help you. So once you finish looking at my PowerPoint, once you've finished getting your 11 body systems worksheet and starting to think about which 2 am I going to research, then go to the book, okay? Have a quick flick through, look at the subheadings, and then you're going to go back to those as you go through your research. That's what you're going to look through, okay? It talks about all blood tests, urine tests, what is it they're going to do, what is it they're going to look for. Now, for M1, I haven't given information on M1 yet, so don't panic, but that is part of assignment 1. On page 204, there is information about M1. So again, those of you who are being a bit savvy, have a look, okay? So therefore, you can start off P1, P2, P3, M1. That's your assignment 1, 4 pieces of criteria. So you have got to finish this by the 1st of September, all right? You need as much of this done. I'm not going to put a turn it in link up yet. So just keep it really safe and just save it, unit 14, assignment 1. You've got to stop saving it as Christina's work, okay? Because, we're in year 2 now. It's going to start getting really confusing. So, unit 14, there we go. There is your starting point. Are you excited? I am. Have a great summer. Just do this little bit of work, and honestly, it's going to make your life so much easier. If you do not do this work, September is going to be horrible. I promise. Do it. All right. Bye, guys.